So, what is Zetia and how does it work? Zetia, also known as Ezetimibe, is used with a low cholesterol/low-fat diet and exercise to help lower cholesterol in the blood. It may be used alone or with other drugs, such as statins or fibrates. Zetia works by reducing the amount of cholesterol your body absorbs from your diet, which in turn may help prevent strokes and heart attacks. When it comes to taking Zetia, the recommended daily dosage is usually once a day. It can be taken with or without food, but it's important to take it consistently at the same time each day to get the most benefit. It's best to follow your doctor's instructions on when to take Zetia and to not miss any doses. It's important to note that Zetia is not a substitute for a healthy lifestyle, including a low cholesterol/low-fat diet and regular exercise. It should be used in combination with these lifestyle changes to get the best results in lowering cholesterol levels. As always, talk to your doctor about the best approach for managing your cholesterol and whether Zetia is right for you. Make sure to read the patient information leaflet provided by your pharmacist before you start taking Zetia and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily with or without food. The dosage is based on your medical condition and response to treatment. If you are taking a bile acid sequestrant, such as cholestyramine, cholestyramine, take Zetia at least 2 hours before or 4 hours after taking the bile acid sequestrant. These products may bind to Zetia, preventing your body from fully absorbing the drug. Take this medication regularly to get the most benefit from it and try to take it at the same time each day to help you remember. Keep taking this medication even if you feel well. It may take up to 2 weeks before you get the full benefit of Zetia. Your doctor has prescribed Zetia because they believe that the benefits of this medication outweigh the potential risks of side effects. It is important to be aware that some people may experience liver damage when taking Zetia with a statin or muscle damage when taken with a fibrate or statin. If you notice symptoms such as nausea, vomiting, severe stomach pain, yellowing of the eyes or skin, dark urine, muscle pain, weakness, or unusual tiredness, it is crucial to notify your doctor right away. While serious allergic reactions to Zetia are rare, it is important to seek medical help immediately if you experience symptoms such as rash, itching, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. For those in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Zetia, it is important to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions, so it's crucial to discuss this with your healthcare provider. In addition, it's important to disclose your medical history, particularly if you have a history of liver disease. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Zetia should only be used if clearly needed. It's important to discuss the risks and benefits with your doctor. It's unknown if Zetia passes into breast milk, so it's important to consult with your doctor before breastfeeding. As always, it's important to follow your doctor's recommendations and guidelines when taking Zetia, including the recommended daily dosage and the optimal timing for taking the medication. When taking Zetia, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to follow your doctor's approval when it comes to starting, stopping, or changing the dosage of any other medicines you may be taking. This will help ensure the safe and effective use of Zetia in your treatment plan. If someone has taken too much Zetia and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek medical help immediately. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share your Zetia medication with others. Your doctor may also want to monitor your cholesterol levels and liver function while you're taking Zetia, so make sure to keep all your medical appointments. If you have any questions, don't hesitate to ask your doctor for more information. If you forget to take a dose of Zetia, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Zetia at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When it comes to disposing of Zetia, do not flush it down the toilet or pour it into a drain unless instructed. Instead, consult your pharmacist or local waste disposal company to properly discard the product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.